Good afternoon, everybody. Actually, my name is Greg Rossi, Chief Operating Officer of Meduit. With me is Jeff Neiman, our CEO. Jeff, if you want to kick it right off.
Yeah, sure. Thanks for joining us today, everyone. We've had some great opportunities to really experience different self-pay interactive models with patients over the last couple of years. And, the goal today is just to share our experience there and, seen a lot of gimmicks certainly around self-service and, just want to dispel some myths and share with everybody what works versus what actually doesn't work. And, again, if there are questions that come up, please just enter them in the chat box, or we're happy to answer them at the end of the presentation as well, if you want to hold on to them. By way of quick background, as Greg said, I'm the CEO of Meduit. I spent the first half of my career on the provider side of the fence in senior operations roles, both for HCA's group, kind of what today is their Parallon group, as well as with Tenet, and was one of the founding executives of Conifer, which is now their third-party outsourcing group, and then kind of spent the last 10, 12 years or so on the vendor side of the fence with Symetrics, which is now Navigant Guidehouse, and now with Meduit. So certainly have walked in the shoes of several of the folks on the call today, and just dealing with call center issues, patient type issues. Do you use new technology? Do you not? All those kind of interesting questions, and hopefully we'll be able to help you think through some of those today. Greg, you want to do a quick introduction?
Yeah, absolutely. So I've been in the call center space now for almost 30 years, dealing with patients. Jeff and I obviously work together here at Meduit, trying to take lessons learned across of our experience in the revenue cycle world, understanding how to take technology, how to blend that to create a full service solution, and trying to take lessons learned from other industries, but really understand that you have to healthcare-ize anything that you're going to do. Patients are different than general consumers. And I think in the 30 years that I've been doing this, understanding that difference and being able to deliver the best possible patient solution is at the core of what we try to do. And we're going to talk a little bit about, what are some of the cost-cutting measures? What are some of the benefits for systems and providers with some of these solutions, but also always in the back of the head is, patient first. And so I think that's a lot about where we focus as an organization. And in 30 years of doing this, I think if you put the patient first, you tend to get better results in the backside of things.
All right, I'll just provide a quick overview of Meduit in case you're not familiar with the organization. We are a national revenue cycle management organization. I think in the most recent survey, we're ranked the third largest in the U.S. by Modern Healthcare. The map that you see here with the pins on it are just kind of indicative of where we've got customers across the United States, but we're in, I believe, 47 states today. Where you see the orange shaded states, those are where we actually have operating or processing centers. You see those listed as well on the right side. And we are headquartered in Charlotte, North Carolina. I think the next slide here, we've just got a few other quick stats and facts. I think today we're actually up to about 1,000 hospitals and large physician practices that we serve. About 60,000 total physicians are on one of our various service lines or platforms today. We've got about 1,500 employees across those locations that were on the prior slide, and managed over $41 billion in AR last year. I think one of the things that certainly makes Meduit unique and different is when you look at our size and scale, and kind of that number 3 ranking as far as size goes. We are not owned or operated by a healthcare system. We don't have a big anchor customer that makes up 50 or 80% of our revenue stream. So we do business with a ton of large regional and even national healthcare systems, but all the way down to individual practitioners. But at the same time, don't have one way of doing things and aren't kind of one-stop shop. We certainly have best practices and things that we recommend to our customers, but are really focused on being more of a true partner and creating partnerships where we can help deliver solutions that may not be cost effective for our customers to deliver on their own. And so every customer relationship is extremely important to us. And, we focus very heavily on that. We use a net promoter score to keep ourselves honest and true to making sure that we're providing great service. And over the last 4 years since we've been doing the net promoter score, have consistently scored in the 50 to 60 range. Although that's typically a failing grade in school. If you're familiar with net promoter, it goes from negative 100 to positive 100. So that score puts us up there with premier brands that you'd recognize like BMW and Ritz-Carlton and other organizations that are really well respected for excellent service. Just a depiction here, kind of front to back of the revenue cycle, if you will, from scheduling all the way back through charged off collections on the right-hand side of the slide. But the offshoots here with the orange and blue boxes are just the various solutions that Meduit provides today. Obviously, we're all gathering today to talk more about the patient experience and self-service versus a more comprehensive kind of offering of capabilities.
So just to kind of level set a bit of what, some of the key items we're going to talk about. In the patient communication world, I think you can look at some of, what has historically been done with paper statements going out and telephone calls being answered and outbound attempts being made, all the way through to a lot of the self-service options that are really become more prevalent recently as you think about the payment portals, the patient portals being able to go directly into it, texting messages, emails going more digitally to give the patients the opportunity to be able to set up their own arrangements, patient financing, chat, IVR solutions, artificial intelligence based. And so what we're going to be talking about today is really trying to strike the right balance between what has been a really hot topic in the marketplace, which is self-service. And those are tools that are quite valuable. But when you try to go with just a technology solution and try to force patients into a true self-service, you have to think about what your patient base is really looking to do, and almost thinking forward is what should self-service be as a piece of a true full service offering versus maybe some of the things that are being communicated in the marketplace today around self-service being a sole solution to deliver patients their bills and payments and financing and just some of the things that get a little bit overblown there. So we want to talk a little bit about some of the fact and fiction. But as you think about all the different mechanisms of surrounding patient communication and their ability to understand complex billing and what they owe and setting up arrangements to help solve them problems, get them access to charity, being able to identify financing options, all of those different components. Today, it's the conversation is going to be really about how do you balance technology with some of the older school sentiments around statements and phone calls, and what is the right balance for your specific patient base. Even to high tech, super high tech, right?
Yeah, so we're going to start out with what's probably one of the highest tech self-service solutions that we've seen out there in the marketplace. It's certainly a capability that we have and are delivering at a few customers today. I'll share with you at the end of this how broadly this is used, but capability for somebody to download an app onto their phone and have that app interact with them, right? That's probably the most interactive you're going to be able to get from a self-service perspective. You can do all kinds of cool things with this. From a patient access perspective, you can send messages to patients when they walk into the hospital. I guess let me back up and explain geofencing first. So geofencing is a capability where literally somebody's GPS is tracking them on their phone. And when they cross a threshold that you set on a physical map, essentially, you can interact with the patient directly on their phone. So they drive into your parking lot, you could send them a text message or just a little message on the app, either or. You've seen those sometimes where something pops up on the primary screen, and then they have to click on the app to see the message. But you can tell them welcome to the hospital. You could tell them where to park or how to use valet services if you wanted to. If they're already pre-registered and you know where they need to go for the service, or where you want to direct them to, you could do that, right? Providing an online map to them of the hospital that pops up within the app. Again, conversely, when they leave the hospital and cross a barrier, you could send them a patient survey link if you wanted to say, tell us about your experience today, and get real-time data back that's probably much more valuable to your organization than the traditional type of HCAP surveys and things where you may not be getting the patient for a week or 2 or even 4 weeks after service, and the experience isn't as fresh in their mind as it would be if you were able to get them right after the service was completed. So that's pretty cool capability. You could send them a message from the CEO of the hospital or from your chief medical officer or something. There's all kinds of capabilities that you can use once somebody willingly downloads an app to their phone. From a back office standpoint, again, there are significant interactive capabilities here where somebody could scan a bill and in this particular case, there's a patient concierge who can pop up on their phone and walk them through different areas of the bill and what each area means. Really helping them understand and then link in from that app into a payment portal to make a payment, or click a button and directly dial somebody in a call center to get individual personal experience, lots of interactive capabilities. The downside of this is where we've rolled it out, there's not huge adoption of this, right? So it's really cool technology. It's probably the best self-service thing that's in the market today, but the adoption rates are sub 5%. Just meaning, there's not a super savvy patient base, or maybe people don't want to clutter their phone with another app, as the case may be. But the people who do use it pretty extensively and complete transactions on the app with zero human interaction and have a lot of success with it. Another limitation to the app that we've seen so far is that people under the age of 55 are very likely to use it versus those over 55 are very unlikely to use it. And that's a trend that we see kind of across self-service applications in general. We'll talk more about that today through the presentation, but the younger patient population is certainly going to be more apt to do self-service.
So from low tech, right, sending a statement in the mail to a patient, to the highest tech and everything in between. I think the key is what is right for each organization may be very different based on where you're at today and what is the next logical step forward in enhancing the patient engagement.
All right, so just a quick rundown of what we hope to cover today. We want to talk about the different self-service solutions that are out there. We started with that first one that's pretty high tech with an app on your phone. Talking through a little bit when patients actually need personal assistance and self-service isn't going to cut it. Self-service has its limitations. It sounds really cool and really great to not have to staff call centers anymore and things. We just haven't found that to be the reality. And so I think, sharing some experience there will be helpful. Our recommendations on the best combination of self-service and what we would consider a more full service or more comprehensive solution. And then we'll share some real world case studies of situations where we've seen people focus on self-service and what the real outcomes are versus maybe the headlines that you might read in a news release or something.
So let's just talk about some of the facts as we, again, try to sort through facts and fiction. Not a big surprise. According to Forbes, over the last 20 years, patient portion has grown from 5% to over 35%. So again, more of the responsibility, high deductible plans, all of those different reasons we're well aware of, that more of the dollars are being pressed onto the patient's responsibility. And therefore, we have to be more vigilant about how we take advantage of those facts and work with the patients the best possible way to be able to resolve those claims. The burdens, right? The reasons, obviously, the cost sharing shift from employer plans to employees, the less insurance for more coverage, high deductible plans, and just naturally rising cost of care. Again, none of those facts should surprise anybody that's on this call. So the results, what's happening? Patients are obviously struggling to afford their care. We still know how complex healthcare billing is, and helping patients and educating patients on why they owe what they owe, and more importantly, how can they resolve issues? What has been billed? Is there additional insurance opportunities? All of those things are tied in with the patient communication plan and the tools we talk about throughout the gambit from lowest tech to highest tech. And then obviously the providers on average are collecting anywhere between 20 to 55% of what patients owe. There's still obviously a significant amount of money that is being written off on a regular basis. And collecting those fees can be expensive, whether you are trying to manage the process yourself, you're using vendors. If you're sending statements via the post office, right, we're now sitting on our 8th postal increase over the last several years. That's not going to stop. How we communicate with patients is not getting cheaper. And so managing those components become more and more important as part of our cost to collect basis within healthcare. So if you think about the self-service collection solutions, we talked a little bit about the phone apps and those online portal access. The same thing as with the phone, giving people the ability to self-service via phone with an interactive voice response system, whether that is them being able to gather information, being able to provide information, make payment arrangements, whatever it may be. We talk a lot about the web-based solutions and texting and things along those lines, but there's still the phone component of things. So those are kind of those main self-service solutions that are out there. They're obviously convenient for the patient, and what you would hope is that you're transitioning to lower cost solutions. If the patient is managing it themselves or managing parts of it themselves, that's less FTE. If you're able to deliver something digitally via text or email versus having to send it snail mail, you're talking about 1/10 of the expense of what it costs to send it via the post office. And obviously, all of those things combined with those higher expenses to deliver these services to patients, it's the natural reason why self-service is important. But as we talked about, it's a balancing act between, what you're dealing with in, say, Medicare age patients that are preferring traditional paper and phone communication, even to the point of people wanting to still have the coupons to mail payments in. You've got a significant portion of that group you still have to serve as part of this. Also, as we've seen, approximately 50% of patients still prefer to speak with an agent in regards to their bills, even if they do have all that same access to self-service items. We have pretty much everything we're going to talk about for self-service and full-service solutions. We have that in play with many clients across our bases. So we get a pretty good range of data from that. And then obviously, as you think about the more complexity a situation becomes, why do I owe X? I don't understand my explanation of benefits. Why am I receiving this bill from multiple different entities? All of that tends to typically require human assistance, and therefore the basis need for educated, empathetic call center folks. And so a lot of folks do actually drive to those self-service solutions. But unfortunately, as you can see from the bad news here, 60% of those patients that begin to use those self-service options still need to pick up the phone for assistance. And we've seen this. We deal with millions and millions of calls on a monthly basis, on an inbound basis, and probably the same on an outbound basis. We are using texting to drive patients to portals. We know patients go directly there themselves. As we tracking this, if you've got 50% of the people that prefer the phone connectivity to start with, the other 50%, of 60% of them are starting self-service and still go to the phones, then you're talking about probably closer to 20% of folks that are truly using self-service and only self-service to be able to resolve their issues. So that's the balance. That's the whole concept in the conversation. All of the tools being available, I think that balance of having that call center behind it is imperative to being successful. Oops, Jeff, almost skipped your slide.
No, so bottom line here, I think is what we're seeing. You'll see a lot of self-service solutions come in. They're high tech. They can, create an interactive website for you that, they'll say, oh, your patients can just interact with this and it'll replace your call center, or it will reduce your inbound calls 20 or 30%. And most of them are pitching that you're going to see this big lift in revenue, right? Once you put these self-service solutions in place, all these people that wouldn't have paid you before are now suddenly going to pay you. Do we see some cost reduction? I'll caution, I know we say zero positive financial impact, but that's really from total reliance on self-service solutions. We've literally seen a couple customers that we've worked with who had shut down their call centers because they got sold on this thing that if you just send letters and direct everybody to your payment portal, you won't need a call center anymore. And you'll be able to save all this money. And it just hasn't been true, right? It's been pretty disastrous for a couple of folks who have bought into that pitch and tried that solution at the outset. We have yet to see anybody get a true lift, and I'll talk about a couple of actual patient or actual hospital or health system experiences here in a minute around this, but we really just haven't seen any lift in patient collections at all from those solutions. Do we see some minor cost reduction? We do see a little bit, but again, keep in mind back to the stats Greg just showed, only about 20% of patients are actually going onto a website and completing a transaction on a website, right? Even a little over half of the people that go out to the website don't just pay and finish the transaction. The things that they see on the website create dissatisfaction or more questions than they had before they logged onto the website. And now they want to talk to a human being to answer those questions. So again, not to downplay self-service, we absolutely think it's a great thing and something that you should have for the 20% of people who are super savvy at technology and want to not speak to a person. Hey, that's my kids. They would rather me, text them from the next room over than go knock on the door and talk to them. But at the same time, you have to be conscious of the other side of this. It was actually interesting, unsolicited over this last week. I spent some time with my mother celebrating her 75th birthday. And she brings up to me just out of the blue in the conversation about her local hospital reaching out to her and sending her a text, and she doesn't respond to those. And anytime they call her, she said she just tells them to send her a bill, and when she gets it in the mail, that's when she'll pay it. Right. So, I mean, again, you just see the spectrum of very young folks who are kind of grew up in, the tech world on cell phones and things versus people that haven't grown up with that technology and just aren't that comfortable interacting and doing self-service. A good portion of your Medicare population is going to continue to only pay you off of letters and traditional methodologies, and so you can't dive in all the way one or the other here and satisfy your entire patient base and mix of patients.
Our recommendation is clearly to continue to add solutions that are going to get your patients engaged, that are going to reduce costs, that are going to help drive collections and performance. All that's true, but as we're seeing over the past, say, 18 to 24 months, we've seen many a client that we're talking to that have tried to force all of their patients into a virtual digital self-service solution. And then the question is, how do they opt out? And what happens if they don't want to respond that way? And that's where I think the balancing between self-service and full service is so important. If they don't have the ability to have that backup solution, you get patients that get lost inside of the revenue cycle. And I think that's the one thing that creates more problems than any cost-related savings that you get from this. So really what it's about is about taking the next steps. Jeff talk a little bit about some of the case studies of some of the examples where maybe people have missed that.
Yeah, so again, I told you we talked about a couple of these. This first one is a multi-hospital health system. They're a pretty dominant provider. You would know the name if I put it out there, but they really got sold pretty heavily on self-service technology deployment, and that they were going to see a huge lift in cash collections, that they had never seen before. They were going to reduce cost and eliminate major components of their call center if they implemented a interactive website. And so what happened? If you look at the headlines, you'll recall me talking about that. If you look at the headlines on a case study that's actually published, total patient cash went up by 13%. So the organization that came in and built the website is trumpeting that, right? We generated an additional 13% cash from patients year over year once this website was deployed. If you dig into the data, though, as we did, because we were there before and after this engagement occurred, there was a pretty big expansion by this health system over the course of that year, and their patient volumes went up 13%. So although patient cash was up 13%, patient volumes were also up 13%. That's not mentioned in the public study that I just talked about. And so the reality is, this really didn't generate any net new cash. Did more people pay online year two versus year one? Yes, more people paid online than didn't, because there wasn't an online option available prior to that, but it didn't generate any net new patient cash for the health system that they wouldn't have gotten previously with their old, more traditional methodologies. So again, this is where we say, and this isn't the only one we've seen 3 or 4, but this is just an example of one of those where we don't see any significant lift in patient collections, right? Do we see patients shifting from one to the other? Do we see a slight downtick? I think there was maybe a 1% or 2% reduction in inbound phone calls into the call center or something, but it wasn't a material reduction where they could have even capitalized on staff savings in their patient account services group. So really no material increase in this particular case.
So there are facts we all know in the healthcare world. Be careful of some of the maybe exaggerations that are out in the marketplace as well.
Yeah, you have to dig into what's not said as much as what is said in the some of the flash and awe of some of the promises that are made. Another case study that's slightly different here, where there was an organization that really was just using letters and inbound phone calls only. So they were staffing their patient account services group just to take inbound phone calls. They weren't doing any outbound calling. They were not really doing any sort of self-service options at all. We engaged with that group, brought in, website, brought in texting, brought in segmentation of patients. So you're not necessarily treating every patient exactly the same. You're looking at, hey, if somebody has $100 bill, we can probably send them a letter and offer them a website, and that will likely be pretty effective in getting them to pay, versus somebody with a $5,000 bill probably isn't going to pay unless you call them, right? So starting to treat patients a little bit differently and being more thoughtful about how to approach each patient individually based on, their balance, their type of service, their likely financial circumstances, those kind of things. Those types of things as a comprehensive package certainly can drive significant results. But again, I want to caution, it's not like we were just introducing one new tool here. We were comprehensively redesigning from a very low tech type of solution to a much higher tech type of solution with multiple ways to engage patients based on their individual preferences, and really driving them toward what we could kind of mathematically determine in advance of even reaching out to them what their preference would most likely be, right? So sending a text to people who are more likely to respond to a text instead of making a phone call, versus making a phone call and never texting some of the patients in the same population. So this was a 5-hospital system. In their case, we did see an increase in patient cash in the early out portion of the process by about $500,000 per month. We could argue, was this a acceleration of cash or was it truly net new cash? We didn't really do that analysis because we didn't have a view into their bad debt placements and the performance of their bad debt agencies in this individual case study. So I can't answer that. This could have been all just acceleration of cash from bad debt into early out. Regardless, that's, a bad debt agency that they're not paying fees on and paying, a third to fourth probably of what they're paying the bad debt agency to a lower cost solution and getting those dollars in the door sooner, reducing their bad debt reserves. So there were certainly financial benefits to the hospital, even if it was just cash acceleration or health system, I should say. But this was to the tune of about a $6 million a year benefit to a 5-hospital system. So is there real opportunity here if you're not engaging in kind of more comprehensive solutions? Yes, there is. But again, I'll caution this difference between the first case study and this one is in the first one, it was just introducing a self-service option to an organization that was already doing everything I was talking about just now on the second case study, except for self-service, versus the second case study is somebody who was using just traditional letters and inbound phone call answers only to a much more comprehensive, engaging solution.
So the right mix, the convenience of digital, self-service, tied in with that compassionate, educated, call center human component. That's really, where I think the heavy focus should be. So as we talked about considerations, I think it's about expanding what we've got. I think everybody 100% has the bottom with follow-up mechanisms, less or so on chat. I assume everybody's got call center. They're using interactive voice response. Maybe not everybody on email, on text. I think the key thing I talk about, the 50% of folks that are not necessarily using text to portal today, I think that is probably one of the big steps forward. I know internally, especially with our extended business office solutions, we probably see north of 20% of connects via text are going straight to the portal, meaning 20% of the people we reach out to are clicking, going directly into the portal and self-service. And that's obviously huge because of the cost benefit, but you're also getting that patient into self-service. You're trying to change the culture of how they deal with their claims. Whether it's a MyChart on Epic or whatever it is, trying to get them retrained into how they're going to solve things in longer term basis. And again, if you're doing it well, you've got the right messaging, the right technology. For us, example, as we get 20+% of people that are going directly to the portal, we get about 1% of the people that pick up a phone call and call us in that text, right? We give them the option to go to the portal to call. And we actually get less than 1% of the people that actually put stops. And that's huge. If you think about typically the texting, they're all going to have those regulatory compliance responsibilities that you've got to give people the ability to opt out. That stop percentage being so low is huge. It shows to your adoption rate based on if you aren't getting 20+% connection rate, or you're getting higher than 1% stops or higher than 1% calls, probably got an issue with what technology or the methodology and how you're expanding the use. So that, I think, always top of the page. Most people have the web portal already. The apps and chat, I think, are those next tier in growth. And again, it's the call center. It's dealing with patients for as long as I have. I still think you've got to have the right call center, empathy-driven healthcare experts to solve those problems. That first call resolution, that high 90% patient satisfaction, all those things are a key component to having that well-balanced patient solution. We talked about a lot of those things in real-time connections. Some other considerations, especially that's I think vital to being successful, using a speech analytics and voice analytics technology that not only records those calls but analyzes them, that is identifying where you're getting the most positive outcomes. What is the voice of your customer? What is the patient's actually saying on those calls? Where are the biggest areas of concerns? That type of technology is vital in being able to capture that information. As we think about patient satisfaction surveys tied to these things, being able to, getting the voice of that customer, being able to ask very specific questions that allow us to pinpoint issues, improve and score and benchmark that financial experience for the patients and anything else that may have come up during service. And then being able to provide that back directly to the providers and being able to show them what it is that their patients are saying. That feedback loop in any part of the revenue cycle, I think, is key to being able to take those next steps. And so from an additional consideration, if you're going to run call centers, they better have this type of technology to ensure that you're maximizing patient satisfaction.
Yes, I think, at the end of the day, obviously, we're recommending that combining self-service solutions with those more traditional full-service solutions into a comprehensive patient engagement model is the way to go, and really the only way that you're going to get a lower cost, higher cash kind of solution in your early out group. If you have questions, and we'll stick around here, happy to answer questions if we have some from the audience, but after the fact, if you have questions or want to engage or talk about anything or our experience or share data or things of that nature, feel free to reach out and contact Greg or I directly, or kind of our general line that you'll get a hold of somebody are here as well and our website. All right, questions.
So if we were going to try to prioritize something, what would you think as far as like the most important ones would be to offer?
I think most people said that they already have the web portals. So, patient portals, I think that's key. Obviously, if you've got the call center, having the interactive voice response system to, again, allow. Oh, what do we got here? Okay. All right, good. It was just popped up there. So the interactive voice response system. So again, allowing somebody to self-service even when they do want to make that telephone call. I think that's key. And then if you can't tell, obviously we've had a ton of success and have had a lot of positive feedback from patients and providers all over the country. It's the right texting solution. I know we developed our own specifically so that we'd have all the right mechanisms to text to the patients, give them all the options in the world, be able to use that text to connect back into the portals, be able to self-service, be able to pick up the phone and call. Expanding text is significant of value as I think that there's out there. We know chat's got some value, but we're not seeing the same ROI. We know that apps can do amazing things and definitely differentiate you in the marketplace, but the adoption rate, I think, is still early on compared to texting has much wider acceptance. So if I was putting those things in order, I think making sure you've got the right portal, the right IVR solution, those drive the heavy self-service, the text outreach, I think is probably the next step for prioritization. Looks like we've got a quiet group today.
Always a quiet group.
That's okay.
When it comes to patient support on website and phone apps, do you find that patients prefer chat or calling?
Calling still. Yeah. Ask me again in 5 years, maybe it'll start to shift, but right now still seems pretty significant on the call side.
Okay, the questions are flowing in now. What about the average increase in collections moving from only self-service to a combo of self and full service? What's the average increase you're seeing in collections?
Yeah, that's a bit difficult just because it's somewhat depends on what is really rolled out, what your current solutions are versus adding X and what your baseline is. To just put a specific number, Jeff, I think it kind of varies quite a bit on a lot of different things.
Yeah, I think if you're moving from low tech to kind of more of a full service solution, in those cases, I think on average, we've probably seen about a 20% lift in cash collections in the early out process, some more, some less, depending on how much you're doing, right? Back to if all you're doing is sending letters and answering inbound phone calls, there's some pretty significant opportunity there. But we've
Yeah.
even seen some lift, again, with people who kind of got sold on the send letters and put up a website. Moving back to more comprehensive solutions, we've seen, 10, 20% lifts there as well.
This is Jim Butterfield. A question about web chat. Do we as a company man that, or is that a man from a outside source that then tries to direct the patient accordingly? I find it very frustrating when I web chat because it ends up being a robot and they said, "Oh, I can't answer that question," or that's more frustrating than waiting on hold, I think.
Yeah, and so you're talking about chatbots, and so there's obviously some functionality that you can use the chatbot solution where it really is, the computer trying to direct you. I think from our experience, especially connecting, directly from somebody on the portal, we would want to almost use a call center type agent that is fully versed in all of the insurance processing. The same type of person you pick up the phone that's going to solve that problem is kind of the same type of person we'd want behind that chat. There's some value to some basic questions, the navigational type of questions you can use chatbots. So there is still some value there, but I think once you get past X level of questions, we would typically recommend that, whoever business office, extended business office, vendor, whoever it is that is your subject matter experts that are answering the calls from patients, probably want that same type of quality that are working in the chat environment, or even a two-way texting session along those lines.
Okay, thanks.
Yeah, I mean, ideally, I think you want, the chatbot maybe asking the first couple questions so that when you deliver it, ideally, if your technology is interactive with chat, you'd ask, for example, do you have your account number or your medical record number or whatever, and the patient could enter that, and then you could screen pop the account to the agent that's actually going to work with the chat. So whether that's in-house or it's, maybe you're using a third-party early out vendor today, that's something certainly they could do for you if they've got that capability from a technology perspective. So it could be in-house or third party, but I think I agree, James, what you don't want is a third party who doesn't know how to resolve it, trying to field the initial questions or something and then transferring it. That seems clunky to me as well.
I can't think of internally how we'd be able to manage it from a workforce perspective of having to be live that often. So I don't know, just thinking that.
And what we do basically, we don't have people fully dedicated to chat because the volume tends to be much lower than other things. So what we would typically do, and again, this is a system capability, is there's skill sets we can set in our system. And so we would take people who are really skilled at typing as well, right? We don't want somebody who's two-finger typing doing chat. But we would take, our most knowledgeable collectors who are able to multitask effectively, who can type really quickly and things. And those are the folks who would be tagged with a chat ability so that when those chat messages come in, it's going to a select group of 5 employees that handle chats, not to the broader world of, in our case, it'd be the broader world of several hundred employees, right? There's a very small handful. So, in your local office, maybe it's only 1 or 2 people if you've got that capability to manage it through skill sets.
So it's still technology that's pretty low in use.
Yeah, so that's probably hard to manage if you don't have that kind of integrated in your technology stack today.
Okay.
And the worst thing you can do is probably try to set that up or try to Band-Aid it together and then have an unhappy patient because nobody's responding to them when they try to chat, right?
Right. Good, thank you.
Yeah, thank you. Any other questions here?
If not, thanks. Appreciate everybody for joining the session today.
Yeah, thanks for joining. As we said, we're happy to do follow-ups individually if anybody has additional questions or wants to brainstorm something or get some data to help make a pitch that you're trying to make if you're trying to expand into other solutions and things.
Thank you both. We appreciate it. We'll get the recording and the PDF out here shortly to everyone that attended. Thank you for attending today.
Thank you all.
Have a great day.